Bring you more news as scores of unemployed doctors in KwaZulu-Natal have now arrived at the Provincial Health Department in Pietermaritzburg to hand over a memorandum of demand. The South African Medical Association's trade union released findings from a recent survey that indicates that over 800 fully trained doctors in the country are currently without employment after completing 2 years of medical internship and a year of community service. Newzroom Afrika's Nobuhle Modise joins us now live from Pietermaritzburg. Nobuhle, a very good morning to you. The doctors are clearly quite frustrated as they complete their internship and left with nowhere else to go. What are you finding as you interact with them?
I mean, you're right to say that they are frustrated, and this is what brings us here today. I mean, you remember last week, Health Minister Dr. John Parker just saying simply that there isn't any money. He cited budget constraints, also saying that the cost of employment is at almost up to 65% of some budgets, and also citing that annual increase of 7.5% and other benefits such as overtime, saying that is exacerbating the situation and just putting stress on this already. We heard him say that last week, and we hear now today with doctors here in KwaZulu-Natal and Pietermaritzburg, where over 200 of them are saying that they're unemployed and they're quite simply tired of the health department reasons as to why they cannot hire them. I have with me, just to expand on this, I have with me Minister who is from the PSA, and I just want him to respond to us in terms of, we heard the minister last week speak about the fact that they simply don't have any money, to put doctors to hire doctors rather. What is your response to this, especially because you know that government is also intending to implement the NHI? What is your response as the PSA? What has brought us here today?
As PSA in the province, we are very concerned that we are sitting here because of the lack of planning. To train a doctor, it takes more than 6 years, which means there's no proper planning, there's no proper directing of fund. We're not talking about the doctors, the nurses. We've got challenges everywhere. The Department of Health seems to have failed, including the minister, because it's not our business that there's no money. The issues of corruption is them that need to be able to deal with it. What we are saying, we are disappointed that they are now reversing the gains of democracy. It is through the employment equity where we said we need more young black doctors. We've got them. They are on the street. It is a shame of them. That's why we are saying we can't be sending memorandum after memorandum. In the apartheid time, we're complaining about the same thing. It can't happen with our own government. We're tired of planning with no direction. The message, as PSA in the province, we are saying doctors that are placed in the Department of Health are overworked. Nurses are overworked because they can't prioritize. They cannot prioritize. How do you then implement NHI in this type of crisis? It is a shame. What's going to happen? Other countries will take these doctors. So we're tired of speeches. We need action. The issue of budget, they must sort it out. They've messed up with that issues of budget. As PSA, we cannot be able to tolerate that things anymore. We'll instruct our members to work as per their job description. They must see some of the doctors who are employed, they work over 100 hours per month. For example, in Escort, one of the relatives attended Escort at 1 o'clock with an emergency because there were no doctors. She was only attended at 6 o'clock. You are facing with more crisis. If the leadership is not want to listen, the president must be able to attend to these matters, because you can't cut budget in the Department of Health. It should be your priority, which means you don't care about the well-being of people. The unfortunate part is that most of these leaders, they've got medical aid. They don't suffer the same experience as our people on the ground.
You've spoken about the fact that you're tired of sending memorandum after memorandum. I mean, what happens here today? You're sending a memorandum. What happens if, your calls are falling on deaf ears as is?
So we are sending a memorandum today. They have it. It's not that what we are telling them today, they are not aware. They are aware. They lack planning. If they are not responding, we are saying we will ensure that the entire health sector attend to this particular crisis. We'll ensure that we'll be able to pick it. Otherwise, if they can't resolve this solution, they must tell us in public. The doctors are supposed to be in hospitals. They are supposed to be in clinic. People are dying as we speak. We need people that will be able to respond. The president has said they are committed in the healthcare workers. They must show it, because these issues of budget, but we see them spending money elsewhere. As PSA in the province will not allow that. We're going to embark on more and more actions, because even professional nurses, there are thousands and thousands of them who are unemployed, yet the population is increasing. The healthcare should be critical. The quality of healthcare is very critical. You might well see during the time of COVID, they source doctors in Cuba because they have crisis here. So if they are able to see what they are saying, there is more that's going to come. They must not pretend as if they don't know about these challenges. These are the people who sit in air condition. We need action as in yesterday. We need action as yesterday.
Do we know if Health MEC is the one that's going to accept this memorandum, as well as the Premier of the province, Are we expecting them to accept this memorandum, or what have we heard so far?
We're expecting, we're happy that we even see the Deputy Minister who's here, the HOD who's here, because we expect the entire leadership to come. The MEC, the Premier, everyone must come, because this is a crisis. You cannot have doctors who are unemployed. They must not talk about the long term. The long term was investment. They've invested over 6 years. They know each year how many doctors will need to be placed. They must be able to take action. I'm saying community healthcare workers, they've been on contract for over 10 years. They're unable to fill position, but position in head office for deployment purposes, those positions are filled, but position of doctors are not prioritized. So they must be able to understand Nelson Mandela never died and fight for them to expose our people. We must be able to take action. We must not be afraid. The doctors must be united. Those that are employed, they must refuse to be exploited, because when they employ doctors, nurses, community healthcare workers, they are not doing us a favor. We need actions. We're very tired of cheap talk. So as PSA, we advocate the rights of workers. We are saying healthcare workers. We have seen the suffering during COVID-19. Even people who passed on during COVID, positions are not filled. It's very sad that we are here. Our hospitals are overcrowded. Go to Prince Mshien at Mlanzi. Go to Escort. Go to Bethesda Hospital. Hospitals are packed. There are no enough doctors. Doctors are a critical element of your human resource plan. They must be able to act. If they can't act, they must get other people who can be able to do a job better. We don't need speeches after speeches. 30 years in democracy, we must protect this game without fear and favors.
Thank you very much. That is who is from the PSA, just telling us why they say that they tired of the cheap talk, saying that budget contracts cannot be the issue over and over again, citing the issue that it might be corruption as well, that's also leading to the problems that we see here. He did mention that the Deputy Health Minister is here. We do see him here. I'm just going to ask my colleague, Museni, to just show you that right now. Also know that they started off at the Lisa campus here in the United States, and then marched all the way here to the Provincial Health Department. And as I'm saying, the Deputy Health Minister is here to receive that memorandum, as well as the HOD, and we'll also give you that footage as and when it happens. You heard Louis from the PSA just speaking about the fact that corruption is one of the major reasons why they're unable to place doctors post community service there. They're tired, saying that they're tired of cheap talk, saying that community health workers as well, it's not just doctors, but everybody's overwhelmed and overworked, and the system is just crumbling under the current government. We'll bring you more of these updates as and when it happens, and as soon as that memorandum is handed over, and we'll get to know who exactly will be accepting that memorandum afterwards.
Very well. A story that we will continue to monitor, of course, as it looks like there will be some sort of announcement from health department officials, but we'll take you back there as soon as that is underway.